talking about being diagnosed with mental health when it's not accurate is like there's again going back to what's going on in our lives. Are we just uninterested in what we're learning? How's the public school system? Is it failing us? Is it not failing us? Are we meant to be doing this work?
You're listening to the Digest This podcast, and I'm your host, Bethany Cameron. It feels a little weird to say that a culinary ingredient such as saffron can actually help with mold, fungal infections, candida, PMS, cancer, ADHD, depression, sleep, and even be better than Ozempic for weight management without any side effects or dependency. But it's true, you guys. And the best part is even kids can take this stuff if you have a child with ADHD. I am joined by Nikki Bostwick, who shares her own story of coming off several medications and utilizing the therapeutic properties of one of nature's most underrated and overlooked flavoring agents. That does more than flavor your food. We talk about how to choose the right kind of saffron, what to avoid when buying saffron, and if you don't even know what saffron is, well, we get into that too. Male, female, young, old, this episode will give you the tools to become a happier you almost instantly, like literally. Did you know August is actually poop month? You guys, there's really a holiday for everything, and we're celebrating perfect poops over here all August long thanks to Olly. Olly delivers clean meals in 5 fresh flavors that even the pickiest pups love, including my toy Yorkie, Pepper, who is the pickiest of picky eaters. Olly is made in the USA with human-grade ingredients, no fillers, no byproducts, and no mystery mush. Just real food your dog's tummy will love. And you'll love Olly too because your pup will be happy and you won't have to pick up sloppy stools in your backyard or give your dog laxatives because they haven't gone. Your dog's poop is a window into their whole body health. It gives you real trackable insights to their overall health. And Olly is the only fresh dog food brand offering free routine health screenings so you can track your dog's digestion, weight, and more. Both our dogs, Sadie, who is a large breed Belgian Malinois, and Pepper, who is a 4-pound Yorkie, both love Olly, especially their fresh beef and sweet potatoes with fresh turkey and blueberries mix. So, how does it work? Just take the 30-second quiz so Olly can know the breed, weight, activity levels, and even allergies your dog may have so they can customize and build your dog's perfect meal plan that's right for them. Choose your plan, full meals, toppers, baked blends, even treats and supplements. Healthy bellies make happy pups. Head to olly.com/digest and use code DIGEST to get 60% off your first box and give your pup the digestive support they need. Plus, it's risk-free with their happiness guarantee because your dog deserves to feel their best and yes, poop their best too. That's OLLIE.com/digest. Hey guys, I want to give every one of you a gift, so listen up. Many of you know that I created my own digestive support protein powder designed to aid in gut health and specifically formulated for those with sensitive tummies. I created this back in 2018, and since then, it's helped thousands of you with digestive issues and given relief. All that positive feedback has encouraged me to expand the Bethany's Pantry line with 3 different flavors, a protein bake, and L-glutamine powder to help heal and seal the gut lining. So as a thank you for being a podcast listener, I want to give you $10 off anything from my digestive support line. You can use this $10 discount on any flavor of protein bake, or digestive aids such as L-glutamine. The one-time code podcast10 will give you $10 off. Whether you're a regular consumer or have never tried but wanted to, anyone can use this code one time as a gift from me. Oh, and a little side note, because we source our pea protein from Europe, I can assure you it's not sprayed with glyphosate because it's actually illegal in Europe to spray pea crops with such chemicals. Europe's standards and regulations on growing crops are far superior than American standards. And that's why I am proud to use such a source for my clean, easy to digest, lectin-free protein powder. Go to bethanysPantry.com, which is our new website, and use the code podcast10 for $10 off anything. Again, bethanysPantry.com, and then go and use the podcast 10 code and you'll get $10 off. All right, Nikki. So I am super excited to have you talk all things saffron. But before we get into it, you know the drill. I like to start my podcast with rapid fire yes or no questions, and you can only answer yes or no.
Okay.
You ready? Okay, there's only 3. Ready?
Okay, yes.
First question, are antidepressants the only answer for depression?
No.
Are there safer alternatives to ADHD meds besides Adderall?
Yes.
Okay. And is mental health often misdiagnosed for something else?
Yes.
I want to get into that because someone misdiagnosed me for mental health. And it's a crazy story, but we'll get into it. But first of all, why don't you introduce yourself? Tell my listeners who you are and what you do.
Hi, everyone. I'm Nikki Bostwick, and I have a wellness brand called The Fullest, and we have saffron supplements. And I'm Iranian, so I grew up really knowing the benefits of saffron as a little girl. And as I got older, I was always really interested in wellness, and I had my own wellness journey that took me to culinary school for plant-based food when I learned how to formulate just anything from recipes to supplements. And even though I'm not plant-based, it was just part of my journey. And I'm so grateful for that path that I went on. And I feel like my destiny is to share about the benefits of saffron to people. It's part of my culture, my lineage. It's everything to me. And when I started talking about it years ago, people would say, "What's saffron?" And the idea came to me when a lot of people were just talking about turmeric lattes were popping off. And turmeric is obviously a beautiful, beautiful tool in my routine too. I love it so much. It's such a powerful plant and anti-inflammatory. But I like to say that saffron is turmeric on steroids. And it's next level. And I think a big part of why more people don't know about it is because it can be less accessible. But I think that once people really understand the benefits of it, it's something worth investing in because it can be life-changing.
Yeah, well, I want to definitely get into the benefits and how we should take it and all of that. And we were talking just offline, and Nikki sent me some of her saffron latte. It was like a mix, and I told her, I was like, it's already gone, like it's already finished, and it is so good. And I think, first of all, I didn't know that you were Iranian, and I'm very familiar with that culture because my holistic doctor is from Iran. And so he taught me a lot of different things that you guys implement. I love like mixing rice with yogurt and doing like different culinary things that he taught me, and of course wellness tricks. So, but saffron is, in case you guys don't know, I feel like first of all, it's very expensive, and it's almost like vanilla bean. You know how vanilla beans are like super expensive, and you're like, what? I just paid that much for like one vanilla pod.
Yes, that's a really great example.
And so why is it so expensive?
Well, okay, so it's only harvested once a year, and it's all picked by hand and, grown in a specific area. You can grow it here in California, but it's very laborious, basically. So there's so much labor that goes into it, which is what makes it super expensive. If you know, or if you're familiar with what it looks like, each flower will ever give you 3 little strands of saffron. These are called stigmas. And that's also why it's super expensive, because you grow this, you have this bulb, you grow this one flower and only will give you the three strands. So when you talk about a therapeutic dosage too, you have to use a lot more. So it's 15 strands for 30 milligrams. So 5 flowers for just one therapeutic dose, but we use 25 flowers per dose in our latte.
Oh my goodness.
Yeah.
Okay, so you also have little capsules. How many strands are in one capsule?
The capsules use a standardized extract that's undergone a lot of different studies. And so to give you an idea, that 30 milligram dose that a lot of these studies are based off of is some of them are in extract form and some aren't, but a lot of these extracts use 90 milligrams of raw saffron to get 30 milligrams of an extract. So, you're talking anywhere between 5 to 15 flowers being harvested for literally just one capsule.
Oh my goodness. Okay, I want to dive in just straight in. What what are the benefits? Because I know people are listening and they're like, okay, well, why are you even talking about saffron? Is it worth like even consuming or implementing into my diet? Because I was doing some research and I heard it's antifungal, anti-cancer, it can help PMS, but like go down the list.
Oh my gosh. Anti-fungal is like one of my favorite. Also helps people with mold. We focus on 5 main things because a lot of the studies are based off of that. And if I were to go, I'll go down the list, but it's like you're at some point, you're gonna be like, that's not real. That's like crazy. It's unreal, but it is real. And there are studies off of it. Anxiety, depression, ADHD, inflammation, sleep, skin issues like rashes, which also I think is obviously the antifungal aspect of it. So anyone with psoriasis, it helps with digestive issues like IBS. It helps with, there's studies for cholesterol, saffron against statins. I can go on and on, but we like to focus on anxiety, depression, ADHD, sleep. So people who have insomnia.
I heard it was even great. Obviously, it's a great antioxidant, which I think that's why it has so many benefits.
Yes.
But I heard it's good for weight management, maybe even better than Ozempic.
Yes. Huge for weight management. And it really comes down to, again, just snacking too. When we're stressed, we tend to snack more and we have this like compulsive snacking behavior. So when we're calm, which saffron helps you become more calm and support your nervous system, and you're feeling more satisfied and fulfilled, then you're less likely to like have stressful snacking.
That's interesting. Well, and you had mentioned it helps with cognitive behavior. And I noticed that for me, I snack when I can't focus. Like for whatever reason, like I'm trying to like read or like write something out like in detail and I can't focus. So I get some like snacks and I like, put everything like not everything, but like one at a time, whatever. It's like a chip or a bunch of grapes or whatever. And I can't focus. So that kind of helps me like focus in on what I'm doing. So to your point, maybe also it helps you stop snacking when you're focused. I heard it's an aphrodisiac.
Oh, huge aphrodisiac. Yeah, it helps with blood flow and circulation, and it's really great for fertility. So it helps you get in the mood. So that's really great for fertility, especially when you're like super stressed out and you're trying to conceive and you're like, I only have like 4 days and I need, then it kind of helps you get back into your body. And instead of like being all up here in your mind. But a big one too is a lot of these things that we're saying, it's so funny because they all have like your neurotransmitters are what's in common with all of this. And saffron is affecting your neurotransmitters. So when, you're happier, a lot of these things tend to fade. It's really great for oxidative stress. But the reason why it's double-blind placebo, so a lot of these double-blind placebo studies found that saffron is just as effective as the generic form of Prozac to treat anxiety and depression. And it works similarly to an SSRI because it's helping, like your body's creating serotonin naturally, right? But then it helps that serotonin stay in the system longer so you can use it before it gets reabsorbed back into your synapses. So that's like an immediate effect that it has. that's similar to an SSRI. But what SSRIs don't do is help your body produce its own optimized levels of serotonin. So over the long term, the cumulative impacts are that it's helping heal the gut so that you're able to create serotonin, more serotonin naturally, because 90% of your serotonin is in your gut. But it's not just serotonin, it's dopamine, and it's norepinephrine. And so if you were just on an SSRI, that would just be impacting serotonin levels. It wouldn't be impacting your dopamine. It wouldn't be impacting your norepinephrine, which affects your energy. And so that's what's so exciting about Saffron is like they found that a lot of these pharmaceuticals take 6 to 12 weeks to kick in, mainly like 6 weeks to kick in for people. But Saffron had immediate effects. Like right after you drink it, you feel that happiness. And I still don't understand. I mean, I feel like the more I research, the more I'm like, I don't know anything anymore. Like, this is crazy. I'm always blown away. But I just have this thought that, when nature gives you something and it's not man-made in a lab, there's so many things happening in the body that we can't trace, because these studies, at the end of the day, it's just, human beings it's like blood work to me, where I'm like, blood work is great, but we decided this parameter is optimal. And then we're looking for this one thing, but there's so much happening.
I love that you brought up too about the antidepressants, and it's only basically just putting a Band-Aid on it because it's not allowing your own body to produce it. And I was reading a study that after a while, antidepressants actually can cause suicidal thoughts, because it's really, you may feel an effect at the beginning, but it's not making your body produce it on its own, like that happy feeling. And so after a while, you don't respond to the antidepressants as you once did. And then you could be even like in deeper, I don't like to cuss here, but I was like, you could be in deeper poop after taking it, because your body doesn't know how to produce it on its own. So I love that Saffron does that. It helps your body basically regulate itself.
Exactly. And I think that's really what we're looking for, is what can we do to help heal and get to the root rather than sticking a Band-Aid on. And this is exciting because there's something that can help you in the interim as you work to support the root cause. I'm a huge believer in it. I drink it every day to help me. I used to take Adderall. I can't believe it. Like, I used to take Adderall in college, and I mean, I have
Well, share your story.
Yeah. Well, my story is, I feel like everything that I'm always talking, I have Hashimoto's, but I don't have it. It's in remission. But Saffron helps regulate your immune system. So people with autoimmunity can really benefit from it. It's really helped me tremendously. I've had a whole crazy journey. When I was younger, my parents are divorced, but we had a really traumatic childhood with them never getting along. And they're both the most incredible parents and so loving, but they should have never been together. And I think I just internalized so much of that. And it led me to become bulimic. And so I had a lot of issues with it's self-harm really. And then I met my husband. We met in high school. We've been together since high school. I was 16. And I was like, oh my gosh, like it just, my eating disorder just disappeared, but it wasn't true. It was just love can change so much. And I truly believe that. And it did for me. And we went to college in Oregon, but then I live in Laguna Beach, and this is where I grew up. And I came back to Laguna, and we were long distance for a little bit. And I felt like all of these issues had like kind of come back that I needed to deal with because I was around my family again. So I did a lot of work on like generational trauma. And I really believe in generational trauma because my mom, her father was executed during the Iranian Revolution when she was 12. And that impacted her story a lot. And that I feel like I absorbed a lot of that. And like, it's part of me. And Saffron she's like obsessed with Saffron even more than I am. And I really believe that that helped her so much during her, just journey in life, having her father be executed because he was the head of something called Savak, which is like the Iranian CIA. And so he was really close to the Shah when the revolution was happening. They took him, and he had the opportunity to flee with his family, and he decided not to. And I didn't realize how much that would be part of my story later on. And I'm just going to speak about this freely, but I'm all about medical freedom. And I like during having kids just like completely changed my life. I was all about biodynamic farming. That's how I found out about Waldorf schooling, and like just like really caring a lot about what goes in my body. And so I think medical freedom is just like a big part of my story and connects me to my grandfather, because I am very outspoken about it. And it reminded me that it's like part of my healing journey. And that's why I'm sharing it, is like with Hashimoto's. Like, it's my throat chakra, and sharing just my story and what I believe in is a really big part of that. So Saffron and being vocal for me was like super, super healing. I felt like I had a podcast, I have this voice, I have this brand, and I wanted to be helpful for people. I don't really share about it that much anymore. I feel like COVID kind of changed that. I was sharing a lot about it, but then I feel like now the information is out there, whereas before it was kind of like, I don't know, maybe more hidden.
The medical freedom part.
Yeah.
Yeah. Well, I think that COVID, as horrible as it was, I think the benefit of it, it really opened up a lot of people's eyes as to what is being hidden and suppressed. And hopefully we are making a change into being more open and having more medical freedom, and having the choice. Because I think, again, COVID really, it shocked a lot of people about the lies that we've been told for generations.
I know. And one big thing was like, as parents, we were having to make decisions for our children, but there's like this standard, right? You're like, okay, I have a baby. The standard is I'm going to give them a circumcision, because that's just what you do in this country, and no one
The
questions
vitamin K shot. Yeah.
Exactly. All of those things are just happening, and people are just like, okay, the doctor is just telling me to do this, I'm just going to do it, whatever. But once it came down to, am I going to vaccinate because adults weren't thinking about vaccines other than the flu shot, and people who weren't going to the doctor or like CVS or whatever didn't even think about it. And then
people don't even know what vaccines are made from, which is disgusting, honestly.
Yes. And so all of these things, I think, kind of led into my path of just sharing. And with Saffron, it's interesting because it's just, okay, it's Saffron, but we're talking about not leaning on big pharma here and finding another path. And it's really interesting because it goes back to children sometimes, because a lot of people find out about Saffron because they're like, okay, my child is diagnosed with ADHD. I don't want to give them Adderall or Ritalin. What is my option here? It's not life-threatening. ADHD is not life-threatening. So they feel more comfortable going to this alternative, which has been double-blind placebo tested to be just as effective as Ritalin.
Okay, go ahead.
I mean, it's crazy.
Well, that was going to be one of my questions is Saffron safe for children? And
yes. So a lot of the studies are done on ages 6 and up. So that's like around the time when you're taking this, ADHD testing seriously. You're trying to figure out what to do. They're going into school. And it's really exciting to have parents leaning into this. I don't have a kid supplement. It's just a supplement for adults, but like kids can drink this, or parents can add it to their oatmeal or pancakes, or my kids my kids have been taking it since they could like have their first sip of anything,
It is this latte, you guys, you have to try it. It is so good, just mixed with water. But I could add it to my smoothie. Like you could add it to literally anything because it's like a powder. It's so good. And I know this isn't like the topic, but the ingredients are so clean. I love that you don't add natural flavors or gums or any of those, like not even stevia, which I'm so grateful for, because I was like, finally something without stevia or monk fruit.
I know all of these things have that in them, and erythritol that can just like destroy your gut. And for me, it was just all about keeping it super simple. And I love the combination of saffron and cardamom, which is what our latte is. It's a full body experience with the coconut, and the coconut is really great because it's a fat, and the compounds in saffron love fat so much, so it makes it more bioavailable.
That's a great thing to point out, because a lot of people will take supplements or things like that without a fat, and many supplements they're fat soluble, and vitamins you need to pair them for them to be bioavailable. So I'm glad you did your research, girl.
Yes. So our capsules have organic MCT oil in them that's derived from coconut. You can get that derived from other things that aren't great, but coconut specifically is in our capsule and our latte.
Okay. Now, I know you mentioned skin health for a second. So if someone's dealing with like even acne or psoriasis or eczema or something, is this something you would take internally, or is it a topical thing that helps?
It's internally, but you can also use it topically. It's just such an major anti-inflammatory, and all of those things are impacted by inflammation in the body. And acne can be fungal too. So it's really, really helpful. I mean, eczema can be as a result of mold too. I mean, there are other things, but there are a lot of people saying in our comments too, they're like, oh my gosh, I had mold poisoning. This helped me so much. I think again, it's an antioxidant, so it's helping on so many levels. But with acne, with skin, you take it internally at a therapeutic dose, and it helps you tremendously. But if you wanted to like make a mask out of the latte, you could. So that's what's
Okay. It does stain, so like be aware, right?
yeah.
Okay.
Well, so okay, we used to make saffron baths. We don't anymore. It's devastating.
Oh no.
Mix it with baking soda, it helps with the staining.
Okay, that's a good tip.
Yes.
Because I think you bring up like skin issues, for example. Most skin issues, it is an internal issue, whether it's a fungal candida or just like hormones. Again, it's all internal. So if you fix that, your skin issues will probably subside. Obviously, you can have bacteria on your face or in your makeup, and that can be a cause too. But I think most people are pretty aware of that. But so I'm assuming it's safe for people with candida and stuff too.
Yes.
Because your latte does it have coconut sugar or no? I can't remember.
It's not coconut sugar, it's coconut water.
It's coconut water. That's what makes it sweet, I think.
Yeah.
Okay.
So the coconut water powder instead of coconut sugar or other added sugars, it's what makes it sweet.
Okay. That's so great. And then hormone regulation, like how does this work? Because everyone's hormones are different. Like I could be low in estrogen, and then the next person could be high in estrogen and low in progesterone. But how does it work for everyone, given that we all have different variables?
It's really working like an adaptogen would. So that's why it's helping people. Your needs are different than mine, but somehow it like goes in and it's regulating your nervous system. It's calming you down. It's helping regulate your hormones as a whole that way, and cortisol. So that's how it's really like, I think it's taking all the things that are insanely high in the sense of like our lifestyle and calming it down so that our body, it's really helping your body do what it needs to do by taming your inflammation and toning down your cortisol. And that's how it's helping your hormones too. But for that purpose, it's really great for fertility as well.
I have a question for you all. What's antibacterial, antimicrobial, anti-inflammatory, contains antioxidants, improves oral health and digestive support, and contributes to wound healing? If you guessed Manuka honey, then you're absolutely right. Every time I talk about Manukora honey from New Zealand on my Instagram, I always get messages from my followers telling me how much they appreciate me introducing this ancient healing honey to them and their family. A little goes a long way, and this honey should be saved for medicinal purposes, not baking into cakes or cookies. It's something I always have in my pantry because it never spoils, ever. And a tiny teaspoon daily is all you need to get the endless benefits both internally and if you apply it externally on your face for breakouts or even burns, its potent healing powers work wonders. Manukora honey contains 3 times more antioxidants than your typical sweetener and the special antibacterial compound called MGO. The higher the MGO count, the more of these antibacterial compounds exist in the honey. It's hard to find Manuka honey with an MGO above 500, but Manukora guarantees an MGO of at least 850. Now it's easier than ever to get Manukora honey. Just head on over to manukora.com/digest to save $70 on their starter kit, which comes with an 850 plus MGO Manukora honey jar, 5 honey travel sticks, a wooden spoon, and a guidebook. That's manukora.com/digest to save $70 plus $25 worth of free gifts. That's manukora.com/digest. Yeah, I think a lot of people may not realize that cortisol is actually a hormone. And when you're stressed, it like overtakes all the other hormones.
Yeah.
So when you're stressed, cortisol is raised and then your hormones go crazy. And that's something I learned like 4 or 5 years ago. And I was like, oh, that's why I'm having like all these issues. So stress is huge. I think people don't realize.
It depletes you, your body. It doesn't matter if you're eating the most nutrient dense food, just not being able to absorb the food because you're so stressed. I mean, that's happened to me. And, you can even be like iron deficient. Like you need to help build blood in your body. And that's like even affected from just stress in your life. It's so crazy because it affects your spleen, and your spleen is what's building blood and helping you manage so many of those emotions.
Yeah. And this is it's not funny, but it's a funny story. So I was super stressed. And so I've been married for it'll be 3 years in November. And so I was so stressed and I could not gain weight for the life of me. And I was eating more than my husband. And my husband's like, dang, you can like put it down. And I was not gaining a pound and I was stressed and nothing was sticking. And finally I was able to kind of like manage my stress levels. And I was like, okay, now I'm like able to absorb nutrients and it's not just like passing through me. And I think that's what or you could have the opposite too. People could be gaining weight. They're not overeating, but for whatever reason, the stress level makes them hold on to the extra weight and they can't get rid of it. So it can go either way.
That happened to me before I had my kids. It was such and I went to my doctor and he was like, you're malnourished. Like you're literally malnourished. But it was all inflammation. It's so crazy how that can happen. This is before I started really using Saffron too.
A lot of Americans now, I mean, we know there's like a huge obesity epidemic, and they're saying that even obese people they're not underfed, but they're malnourished.
Yes.
And that's a completely different thing. You can be overfed and still being malnourished because they're, eating McDonald's or whatever.
Yeah.
But anyways, that's a side thing. So I know I had asked if it could help with cancer, right? And that's a pretty big statement. I don't just say that willy-nilly. So can we get into that and like the studies that you found?
Okay, so it's really interesting because the contraindication for saffron is pregnant women. So I'm going to start with this. It's safe for all ages. It's incredible for fertility. I actually tell pregnant women at around 37 weeks to start taking it for labor prep. It's incredible for pain management during active labor and for postpartum. I mean, the best use case is postpartum because that's where it's been used for centuries. For women that have just had children, but it doesn't affect nursing. However, it's an abortive. So if you take it at like 4 to 5 grams of saffron, which most people wouldn't because that's incredibly expensive, and that would be like, I mean, we have 150 milligrams per dose in our lattes. You'd have to take like 30, 40 saffron lattes in a day for it to be that dose. That's the abortive dose. It's also anti-cancerous, like at those high doses, like very anti-cancerous. I mean, obviously it's supporting your body at the potent dose that we're giving. Our dose is still very potent, but in like traditional Chinese medicine and Ayurveda, the dose that we have in the latte, which is 150 milligrams, that's what people were using back in the day. So we use like a scientific dose, but that's a starting dose of 30 milligrams. But we use the 150 because we don't have a standardized extract. We have saffron in its purest, rawest form, and that we mill. We'll get into that. I want to talk to you about counterfeit saffron. We mill our own saffron because there's so much counterfeit saffron out there. But in terms of anti-cancer properties, already at this dose, I can't say it for liability reasons, but it's really great.
I was reading, there was some studies in the NIH, and they said they found that saffron and its compounds have been shown to selectively kill cancer cells or suppress tumor growth while leaving healthy cells unharmed. So it wasn't killing the healthy ones, just the bad ones. And it says research suggests that this effect applies to several different types of cancer, including breast cancer, lung cancer, prostate cancer, leukemia, brain cancer, and colorectal cancer.
So incredible. I need you to send me the study because sometimes, like, since I started my company, a lot of research has been suppressed. Now that saffron is becoming more and more popular. I have this huge book that I bought years ago. That's like my saffron Bible if people want to learn more about it. But it's Saffron Science, Technology, and Health. And it goes into just like, oh, people can't see it. But yeah, it's called Saffron Science, Technology, and Health. You can get it on Amazon. It tells you everything. And so many studies are in here, decades of research.
I love the books because things online, people can just take them down immediately and suppress the truth.
Yes, exactly. And then, people are relying more and more on ChatGPT, and that's being fed a specific narrative too. So it's really interesting. It's great. It's really great to utilize, but you still want to go into the research, into the books, into what's been there forever to have access to.
Yeah. Okay. So let's get into what should we look for when buying saffron? Because you mentioned counterfeit, like,
Yes.
Is organic important? Is the source or origin important? Like, give us the tea.
Yeah.
Spill the tea. Give us the details.
Here's the tea. This is one of the most counterfeited items in the world. Saffron is cut typically with a bunch of different things. They use red dye and dye certain things and then cut it with the real saffron and sell it to people. If you go to the grocery store, like a lot of people complain, they're like, oh, I can just go to Sprouts or Trader Joe's and just get saffron, which is still pretty expensive. But that's not being third-party tested and undergoing identity testing because it's not and we go further than a lot of people do in the supplement world. But when you're buying saffron for culinary purposes, it doesn't have to undergo much testing. And so, these places aren't undergoing that testing. They're not specializing in saffron buying, right? They're just buying saffron, relying on what the supplier is giving them. And then they're bottling it if they're private labeling it and going on their way. But you really need to do identity testing, which is what we do for every single batch to make sure that it's the real thing. It's pure. It's not cut and adulterated with different things. It's not dyed. Because, we're talking about getting red dye out of our food system right now. And here we are, no one doing the testing on saffron. So getting it in supplement form, getting it in a therapeutic dose, 30 milligrams or more. So in Iranian, Persian cooking, you're not getting a therapeutic dose. You can have the best saffron rice and saffron rice pudding and whatever you want, but most of the time they're not using a therapeutic dose.
They're just using it for flavor.
Yes, for flavor. And I mean, the way Iranians do it is they take the strands and then they activate it in some way, whether it's with a little bit of they grind it and have a little bit of hot water, or you can activate it over ice. It's a cold process that's really, really good and doesn't overheat the saffron. And then you almost like this like water-based tincture that you can use little drops of it in your cooking over time. You can keep it in your fridge and like keep it the whole month. But that's just for the smell, for flavor, and for color. But it's not what you need for a therapeutic dose for these benefits that we're talking about. So 30 milligrams is really important to remember. And if you're using saffron in its regular form, which is the stigmas, I had mentioned it's at least 15 threads is what you need. So you can make like an infusion with it if you want. Like our product is, that's why it's formulated the way it is. It's ready to go. And so if you want to put it in your food, you just add a tablespoon of the powder, or, that way you make sure that you're getting a therapeutic dose. Or we have a lot with our capsules. You just open up the capsules, pop them in to your frittata. And so you're like, okay, I'm cooking for 3 people. I'm just going to add 3 capsules. It's very simple.
I had that question too, if you could open up the capsules, and that makes total sense. I think your latte powder is super versatile, just beyond drinking lattes. I think you could even add it to your rice and just do it that way.
I do it all the time. It's so easy and fun. And you can do it I have a clay pot rice cooker that I love, and I just add it right there.
What are some other recipe ideas that people can incorporate saffron in?
We have so many recipes on our website. Definitely check it out on thefulls.com. We have frittatas, we have cupcakes, we have bark, like chocolate bark with saffron in it because cacao is an aphrodisiac. We have so many smoothies on there.
So it's not just savory, it's also sweet. You can...
Yes.
Okay.
So much, especially ours because it lends to the sweetness profiles with the coconut and the cardamom. It's just, but you can also do savory, and it's fun. Like I do savory pancakes and then like add avocado on top and different, like a little salad. It's so good.
Okay. So you had sent me also some of your pure saffron, what would you call them? Stems or?
That's the stigmas that I'm talking
stigmas.
about.
Okay. You had sent me some of those.
Yeah.
And I showed my husband when they arrived, and we had previously bought some saffron from Costco. And so I took the Costco bottle of saffron out, and I was like, babe, look at the difference here. And he went and smelled it, and he's like, it's like night and day. He's like, I can't believe like the saffron from Costco is like kind of junk now.
Literally. I know. We've been talking about how we need to do like a comparison photo to like show people the quality. And there's different levels of saffron, and I don't obviously know which one, you got, but just going back to your sourcing and origin question, the saffron that's coming out of 90% of the world's saffron comes from Iran. So that's something to take note of. You can get Spanish saffron, which is where our extract is, like technically a Spanish company that's making this extract, and they have a family farm in Spain. But the majority is actually coming out of Iran and being rerouted elsewhere. And there's Indian saffron. There's, which is like the next most popular place outside of Iran and Afghanistan is Kashmir. But the most, like the compounds, okay, let me talk about the compounds. Safranol and crocin and quercetin are these compounds that are incredibly beneficial for oxidative stress, for anxiety, depression, ADHD, so inflammation. Those are the markers that we look for. So my mom always says, like, you get the Louis Vuitton of saffron. I'm like, yes, I do, because I'm looking at the research, I'm looking at the data and the testing, and this has the highest amount of those compounds. And so I'm going to get the most benefits out of there. And that is predominantly a lot of the like really high qualities for those compounds is coming out of Iran and Afghanistan, that like border region with the two. And beautiful. It's beautiful what's coming out of there. And it's more expensive when it's like longer too. So you may have noticed that ours is longer and deeper in color.
It was definitely deeper in color. And I think that when people are buying it for therapeutic reasons, it kind of sucks when they're buying a lesser grade because they think that they're doing it for their health. It's not just, oh, I want to flavor my rice. They're actually doing it to benefit their health, or maybe ADHD, or doing it because of cancer. And so if they're getting a low quality, it's horrible on their part, and they feel like they're really what's the word? But I just feel like
it's like a disservice to them.
It's just a disservice. Yeah. So like if they're trying to do it for their health, they need to have all the details in front of them. And that's another question I wanted to ask. So when we are buying saffron, is saffron better the fresher it is, or does it get better with age? Because like wine gets better with age, but then the olive oil, you want like the freshest, right?
No, you want it to be fresh.
Okay.
I mean, it's not going to hurt you. It's not bad. But it's
Does
nice.
it ever expire?
It lasts about 2 years.
Okay.
Yeah. So you want it to be fresh. I think that it's not until you really explain to people, yes, this is expensive. When it comes to, that's why it's known as expensive in the culinary form, because you're just like cooking with it and you're just not using it for its benefits that are, for anxiety, depression, just the therapeutic benefits. But when you start to buy it for those therapeutic benefits and you compare it to other supplements, it is expensive, but it's not mind-blowing at that point, because you're talking about comparing it to collagen and colostrum and all these things. And it's like, okay, it is part of my supplement routine at this point. It is a preventative, for me, for regardless of whether that's cancer or just getting on pharmaceuticals or supporting your fertility or postpartum, helping you during your postpartum journey. I mean, that's priceless. So when you look at it that way.
Yeah, you bring up a great point, because so many people spend literally hundreds, if not thousands of dollars on supplements. And so when you're thinking of it as a supplement, it's not that expensive. If you're buying a $100 bottle of like, I don't even know, like whatever, colostrum or like Manuka honey, that's really therapeutic, but you only need a little bit. And you bring up a great point. But I also want to know, are there any red flags when we're looking to buy saffron? And this is like, oh, definitely don't get this one.
I mean, to me, it's like, if it's super cheap, it's a red flag.
Okay.
I'm just like, it's not possible. That's just like, we're fooling ourselves at this point. And that's the point where I'm saying you could be doing yourself a disservice, because these people haven't done the testing, most likely, especially if it's in culinary form. I've lost a lot of money myself, and I'm an expert in sourcing. And I've lost a lot of money buying counterfeit saffron that I can't use in my product. And that's why I have strict quality control methods in place, and why we mill it ourselves. So we make it into powder, technically, I guess. But don't buy it in powder form. It's like one thing to really not do. Grind it yourself. Like, we grind it ourselves. When we buy it, we have like not just the identity testing and the heavy metal testing and all that, but we're also doing an eye test. And we look through it visually too. And then we grind it, because when you buy things in powder form, just in general, be selective with what you buy in powder form, because when you start to realize that they could just be putting whatever in there, and this goes even for like Shilajit, it's crazy. It's crazy what people put in their supplements.
I mean, I have my own like supplement brand with Bethany's Pantry, and it's amazing what other similar products are out there. I'm like, this is not right. Like it's completely, I don't want to say wrong, but this is not quality. And I can tell. And to your point is, I think that in powder form, you have to be very selective and trust who you're buying from and make sure they're doing the testing and all of that. Can you take too much saffron? Like, can you overdo it?
You can. And I haven't gotten there yet, and I take quite a bit of Saffron. So everyone's different, and some people really need to, if you know you're sensitive, like start slow. The dose that we give people, like the 30 milligram dose, most people don't have an issue with it whatsoever, but you can work your way up from there. And a lot of people are like, can I have like more than 1 or 2 cups of the latte? Yes, of course, but just start at 1 and then go up is what I always say. But to, the point of having too much, I would say that if you're having like 30, 40, yes, that's too much, but most people wouldn't have that because that's like a $200 day.
Okay. And does it interact with any drugs that you know of?
So it is known to just like be pretty gentle on the system and doesn't interact with other pharmaceuticals. But one thing that I always do want people to know is if they're on blood thinners, just to be careful because it's really great for blood clotting and stuff like that. So if you're already on a drug that is thinning your blood, always talk to your healthcare provider, but just know that could be something.
Okay. Yeah. And that was just, I just want to like make sure that we cover all bases here. Do you know of any side effects of saffron?
So basically it's like not a known allergen. It doesn't really have much side effects, which is what's exciting. Like we can say in these studies, what they found is that there are no side effects. The people, when they were doing the double-blind placebo studies, the pharmaceuticals had the side effects. And then especially with, a lot of the times when you're on pharmaceuticals, loss of sex drive and just feeling emotionally muted is very common, and saffron doesn't have that. But in terms of like, if you're sensitive, you can get a headache from it. Because it's really like, I would say detox symptoms is really what's happening in the body. If you take more than like a lot at once, you can just have like detoxing effects. It's not really going to do much or hurt you or anything like that. But that just, to me, I'm like, that means it's working. But, you just scale back, start slow.
Okay.
Yeah.
I mean, I'm a pretty sensitive person and I didn't feel any side effects from it. So, and I'm pretty sensitive.
Most
but
people don't at all. I get one-offs here and there and I'm just like, okay, like just start slow. But I mean, kids are taking this, like kids are a very sensitive population and kids are downing it. I took it my whole pregnancy too, but I don't like the dosage that we tell people isn't the abortive dosage, but we just tell people don't take it while you're pregnant just because you never want to risk it. Right. But, when some people like email and they're like, listen, like I'm on antidepressants, I'm on an antidepressant and I cannot take it while I'm pregnant. And midwives, all these people like emailing me and I'm like, your client the best. This dosage isn't an abortive dosage. It's just that you have to say a blanket statement, and work with your physician. If you're thinking of taking a drug versus something natural, and it's like small, but therapeutic dose.
Natural, I feel like, is always best. And honestly, I was even like the side effects of Adderall. Now, I was looking this up. This is according to the American Addiction Center. Side effects of Adderall include damage to nerve cells, seizures, brain injury, liver damage, heart attack, stroke, abnormal heart rhythms. I'm like, oh my gosh. And people are taking this all the time.
I know, they're just handing it out like candy. And what's even crazier about Adderall is, it's not crazier. That's insane that they're just handing it out to children too. But you can, like, they have shortages. So they're just having these people super dependent on it. And then they're like, sorry, we don't have any left. And then people are like, okay, what am I supposed to do at this point? My body is addicted to this. I can't function. Like before I was on it, I could still function, but it wasn't optimized. Now I'm on it. I literally can't function. I'm bedridden. Like, what am I going to do? Well, that's what's so great is there is no dependency when you take natural most of the time. I can't speak to everything natural, but with saffron, you don't build a dependency on it. It is helping your body optimize. So you don't have to take it every day. I think it's great because serotonin doesn't pass the blood-brain barrier. So when you're taking it for cognitive function, helping your brain, like with building serotonin, that's amazing. And that's why I take it every single day, because I was on Adderall and this is helping me. But you don't have to take it.
Okay. Yeah, that's good to know. Now I want to know, does it help with sleep? Because it's interesting that it can help with cognitive behaviors and like make you more alert, but at the same time help sleep.
I know people say that all the time to me. And I think the best way I can explain it is just think of it as meditation. And if you meditate in the morning, then you're really aware and you're able to focus, like get to work and get your stuff done, right? But then if you meditate before bed, it's almost like this winding down, helping you sleep better. Because what Saffron is doing is helping you get a deeper, more restful sleep. But it's not like Ambien where it's like putting you to sleep and you're going to be, out of it. It's just calming down your nervous system. So when you're calm, you can focus better. And when you're calm, you can wind down and sleep better. And that's the best way I can describe it, which is crazy.
That's a great explanation. And I had mentioned at the beginning of the interview, if mental health often gets misdiagnosed for something else. And you said yes. And I had told you that I had an interesting story. And this was around the time I was engaged and I was planning my wedding. And I planned a wedding in 3 months. So it was like really quick. And I had gone to the doctor. I think it was just a like normal checkup or whatever. And the doctor was like, "So how are you doing?" And blah, blah, blah. And the conversation was almost comical because I was like, "Oh, I'm fine, but I'm just like not really sleeping well. Like I don't sleep at night." And she's like, "Oh, do you want an antidepressant?" And I was like, "Oh no, I don't think I'm depressed." She's like, "Are you sure?" And she like tried to convince me that I was depressed, like clinically depressed. I'm like, "No, I'm just like not sleeping right now. Like this is just a period of my life, whatever." She asked me and quote, like forced it 4 different times. And she's like, "I'm just going to write you a prescription for some I was like, "No, it's okay. Like, I don't think I'm going to take these." And she's like, "Are you sure?" Like she tried to push it. She's like, you're going to feel better." I'm like, "No, I'm just not sleeping right now." But to my point is, after that visit, you will not believe this, Nikki. Like some people, you can go in like your porthole on like your medical records. Now they marked me as past history of depression. And I'm like, wait a minute. I never even took the pills. Like I never said I was depressed, but she just wrote it in her chart. And now that's on my chart. Isn't that insane?
That's insane. What kind of so in like your insurance company now thinks that you have a past history of
Yeah. And I know I've never even taken the pills, but and now I'm like, I'm not telling my doctor anything. Like next time I go and I'm like, I'm sleeping fine.
That's what's so crazy too, because it's like at least you're an adult and you get to make your own decisions. But once it becomes, let's say you had a child and you were refusing the antidepressants for your child, oh my goodness, what they can do. Like it is so crazy how the system works. And it's so sad because you don't want to have a distrust in our system. And the thing is, I always say it's the best system for like emergencies. I'll go there if I break something, but it does not get to the root cause. It doesn't heal or solve our problems. And with mental health, like you asking me that, we go through natural cycles of, maybe a loved one passed away, or even some people get depressed right after they get married because it was like such this emotional high of like getting to that like finale. I mean, I would say that's like a very, really common thing where you're leading up to graduation, you're leading up to marriage, you're leading up to having this baby.
Postpartum, yeah.
Yes. And then it's like postpartum depression is after that. There's a lot, um, someone passes away and you're sad. It doesn't mean you have to go and resort to pharmaceuticals. But some people feel that that's, this, okay, I'm just going to take this for this short period of time because I am depressed. Well, that's what's like a really great time to lean on to something natural, because if hey, this is just like a short-term thing because this happened in my life, it's easier for you to make a decision to go towards something natural rather than having a chronic condition that you think that you need to not take that. That's a more difficult decision for people.
And then you become dependent on it.
Yes. And your body, I mean, it depletes so much in our body, our bones. I mean, like even just the information that's come out around birth control that most of us have known for a really long time, but now it's classified as, class 1 carcinogen, right? It's unbelievable I was on birth control, Accutane, Adderall. And Accutane never took consistently enough, thank God. But for Accutane, you have to get tested monthly. I had to get blood work done to make sure I could get it. So I'm like, and I was 14 years old, and you're testing me for blood work because it can ruin my body, and you're still giving this to me. Whereas it could have just been a fungal condition, which I think is what it was.
Oh, do you mind sharing how you got off of those? Like, did you switch from Saffron, or how did you have like a withdrawals, or?
I just never took it like consistently enough. And I just refused. And my mom would be like, it's so expensive. You need to do it. You need to do it. But Accutane, I mean, for the people listening, what Accutane's doing is it's drying up the fat in your brain. It's literally terrible. And then guess what? I needed Adderall. I couldn't think properly. So all of these things lead into other issues. It's those games where you're like, you have a hammer and you're hammering down this like thing and then something else pops up.
Oh yeah.
And then you're like, that's how pharmaceuticals I think are and how they have been for me. It's like, okay, Accutane, slam that down. And then Adderall, I have ADHD all of a sudden. And then
Yeah, I've seen like funny memes online where it's like, well, my doctor gave me this for sleep, but then I got depressed. So then they gave me this, but then I had skin issues. So then they gave me this for the skin issues. And then I started to it was just like a snowball thing.
Yes. And that's really what happened. I mean, I think what was happening was, so my mom didn't really get me vaccinated. I was born in the 90s, so I didn't need that many vaccines as you do now. So I got some, I think. And then I was so upset about it. She just never took me back to the doctor to go get more until I had to go to college. And then when I went to college, I wasn't really aware. I thought I had to get vaccinated. So they gave me a whole bunch at once. And then that's when I ended up, what I think happened was I got like chronic fatigue and I was developing autoimmune conditions. And that's pretty common after getting vaccinated to get autoimmune conditions. That's where I think my Hashimoto's came. But instead of figuring out why I was falling asleep in class and not able to stay up and why all of this stuff was happening, they told me, they just prescribed me, my school did Adderall.
Your school prescribed it for you?
Yes, my college did. So for 4 years, I was on Adderall. I was trying to get it in high school, but my parents were like, absolutely not. Which I'm grateful for. I was really young, but I didn't necessarily need it. I just wanted it in high school. And then in college, I was actually diagnosed with it, but it's because I was dealing with all these other things from getting vaccinated. And it wasn't until my senior year, I was really into wellness. Like I got my yoga teacher training certificate. I started teaching yoga, and I was just like, I don't feel aligned with my passion and what's happening on a personal level with me taking pharmaceuticals. And I was on birth control and Adderall. And so I just was like, I'm not going to take it anymore. And I told my boyfriend at the time, was now my husband, I was just like, I'm just going to track my cycle naturally. But I didn't have a cycle when I got off. So off of my
I think
birth
that's
control.
hard to track when you don't have. Yeah.
That's the problem, I think. But I just, I just like did the pull out method, and
You just like went cold turkey.
I went cold turkey, and I did that, and I never had to worry about it. But I mean, I've only ever had one partner my whole life, and so my experience I know is different than other people. But for me, when I went off of Adderall, I was bedridden. I had no energy, and I wasn't like that before. Yes, I could stay awake in class, but it wasn't like I was so addicted. My body was so addicted. And I noticed it a couple times because my school did have a shortage. And so that's when the idea kind of started going in my head where I was like, oh, this is weird. I really need it. I'm desperate for it. And this isn't right. And then it wasn't until I was done with college, I was just like, I'm done. I did it cold turkey. I didn't find Saffron for a bit after that, but it helped me tremendously once I did. But if I had known about therapeutic doses of Saffron, of course I would like take it here and there in my food, whatever. It's always been part of my,
Culinary culture, probably.
culinary
Yeah.
culture. But in terms of a therapeutic dosage, if I had taken it before, I don't think I would have had nearly as difficult of an experience. I have friends, parents who are on Adderall that stopped taking Adderall and just taking our Kinder Thoughts capsules, and they didn't have the experience that I had. So I know it's helped a lot of people, but I had a really rough time getting off of it. And it was something that I just had to know was just the right thing. But it really set me up too for my career, because I can speak to people who have had that and I know their pain. I know what they're going through. I know the fear that they're dealing with, thinking that they can't be functioning members in society if they're not taking that. But it's just the fear that's been instilled in us. It's not the truth. Talking about being diagnosed with mental health when it's not accurate is like, there's, again, going back to what's going on in our lives. Are we just uninterested in what we're learning? How's the public school system? Is it failing us? Is it not failing us? Are we meant to be doing this work? Because I really believe that once you're able to find your calling, it's a completely different conversation, ADHD.
Nikki, I'm so thankful that you're able to share your personal story, because I think that it can be very relatable to so many listeners. And for you to come out and speak about that and now use it as part of your business. And really, I truly believe that God allows certain things in our lives to happen for a greater good and a greater purpose. And I think that you've found that. So I just appreciate you for being open and to using your past to help others.
Thank you so much, Bethany. I appreciate it. That's how I feel about you. I love everything that you share, and I'm so honored to have been on your podcast.
Oh, Nikki, it's been such a pleasure. Now, for those listening and they want to check you out, they want to look at your products, where can they find them?
Yes, so you can find us online at thefullest.com. We're also in all Air One stores in Los Angeles. Definitely go on our website and use our store locator, because we are in different shops and even on the menu at coffee shops across the country. And we're on Amazon too, if you're an Amazon shopper and wanting it really quickly, but definitely our website.
Okay, and if someone could only get one product from your line, what would you suggest?
It's a tough one. It's definitely a toss-up between the capsule and the latte. And what I always tell people is just be realistic about the type of consumer you are. Are you better at taking pills, or are you one that likes to make a ritual out of things? And that's how you can use our powder.
That's a great tip too, because I definitely know both people who are like, I want to make smoothies. I want to I can't take capsules. I want to and then I know the people that are like, I'm so busy. All I can do is pop pills and be on my way. So yeah, perfect.
Both are great. Just know who you are, know what's realistic, and go that route.
Okay, amazing. Thank you so much, Nikki.
Thank you, Bethany.
Thanks for listening to this episode of Digest This. If you enjoyed this episode, please leave a review in your podcast app to let us know. If you're ever wondering how you can support me and this podcast, sharing it with your friends and family is the best way. This is a Wellness Loud production produced by Drake Peterson and edited by Mike Fry. To check out more shows by my team, go to wellnessloud.com, and to email the show, message us at digestthispod@gmail.com. See you next time. The content of this show is for educational and informational purposes only. It is not a substitute for individual medical and mental health advice and does not constitute a provider-patient relationship. As always, talk to your doctor or health team first.
Are you looking to reclaim your health? Tune into the Real Foodology podcast, hosted by me, Courtney Swan, integrative nutritionist and real food activist. I am on a mission to transform our food system by challenging the corrupt practices that undermine our health and replace them with choices that genuinely support our well-being. Listen to Real Foodology podcast on your favorite podcast app. New episodes every Tuesday.